This video is sponsored by Cooper University Healthcare.
Hi there, I'm Andie Summers from 92.5 WXTU and welcome to Ask the Doctor. Joining me today is Dr. Nathan Deckard, the Director of Rhinology, ENT Allergy, and Skull-Based Surgery at Cooper University Healthcare. Welcome.
Thank you.
Actually, I'm in your neck of the woods, so.
Sure.
Dr. Deckard is going to answer all the questions that you have submitted on our website about allergies and sinus issues. And this is so important right now because people are just going crazy with their allergies this season.
They are. It's been rather rough
Yeah. So I heard someone say, and I know that you're not a meteorologist, but I did hear someone say that it's particularly bad this season because in the winter, things didn't have time to die and something. Do you know anything about that?
Yeah, having a rather mild winter, spring started early, things were pollinating early and rather in full force. So people had it a little bit more rough this year.
Good grief. So one of the great questions that we received is, how are you sure if it's a cold that you're suffering from or allergies?
Okay. So for a cold, you're probably going to get a whole constellation of symptoms. But for allergies, we're really focusing on, especially for environmental allergies, we're focusing on itchiness, so itchiness of the eyes, itchiness of the nose, tearing, runny nose, and sneezing. Those are kind of our main symptoms that we're looking at, and those are going to last a little bit longer. So a cold's going to last maybe 7 to 10 days and then kind of die off and go away. Your allergies are going to stay there for the entire season. Okay.
Barb says, what does it mean if I sneeze over 15 times a day? It seems like a lot, right?
Yeah, that's quite a bit. So if that's in combination with those other factors that we talked about, you probably got some allergies. I would start at least with some over-the-counter medication, then maybe go on to something else to see your doctor and get on some other additional medication.
I've been an allergy sufferer for my entire life, and I feel like we've grown leaps and bounds when it comes to over-the-counter allergy medications. But can you talk about what the difference is and when it's time to make the leap to get prescription?
Sure. So most people start out with the over-the-counter medications, the oral antihistamines. We're talking about Benadryl, chlorpheniramine, some of the older antihistamines that have been around for quite a while. And then the Zyrtec, Claritin, Allegra that everyone's aware of. So those are probably the better oral medications to be on that you can get over the counter. They're a little bit less drowsy, less sedative, and work very well for mild allergy symptoms. And then Flonase, Nasacort, the generics for those, the fluticasone, the triamcinolone. Those are good nasal sprays you can get over the counter now as well, and those are kind of a step up, a little bit more of a strong hit towards those allergy symptoms. Those are the ones that you can get over the counter that are easily available. Okay.
So when should you use a nasal spray and when do you use an oral medicine?
So in general, I would start with the oral medication.
Okay.
Cheaper, easy to use. A lot of people don't like sticking stuff up their nose. They don't like the sprays.
Right.
So generally more easily tolerated. If you have symptoms that are still going beyond that, they're not controlled on the oral antihistamines, I'd jump up to the nasal sprays and see if that works for you.
Okay. And then there's a lot of talk about age too. I have a 4-year-old and an 8-year-old. My 4-year-old is now, he's really starting to feel allergies, whereas I feel like he didn't ever really experience anything before. So is there an age that allergies start to affect you? Are you ever too young to be suffering from allergies?
You can be too young. So your body has to be exposed to the allergen first. And your body, the whole idea behind allergies is your body mounts a response to something that it shouldn't. Okay. So it's an exposure to something in the environment that your body doesn't like. And you have to have that exposure first and then have it come around again. Okay, so your next season. So really we don't see allergies under the age of 2.
Okay.
After 2 years old, then you can start to develop allergies. If you've never really had allergies before in the north and you move maybe a little bit further south, you're exposed to a whole new different range of allergens. So you're probably not going to have really bad allergies that first year. If you're a really bad allergy person, maybe you will. But it really takes probably a good 2 to 3 years of being in a new place before you're going to be exposed to new allergens and start to get those symptoms again.
Okay. Now, we thought Barb was sneezing a lot with over 15 times a day. Angela says, I sneeze probably 100 times a day during my allergy season. Is there anything that I can do to prevent this? Because it's so embarrassing at work when I just keep sneezing.
Yeah, if you know that you're an allergy sufferer and you know that your particular season is really the problem for you, so for instance spring and fall are typically the worst ones for people, start your medication a good couple weeks earlier, especially if you're taking those nasal sprays, because it will help to ward that off. It will help to build that defense early.
Okay.
If you start after you already start getting allergy symptoms, yeah, it'll work, but it won't work as well.
Okay, so now it sounds like you want to be then on a regimen and not just treat the symptoms, but really kind of know that it's coming. And it's okay to be on an allergy medication for an extended period of time?
Yeah, there's not really any major problems.
Okay.
Sure, you're going to get some minor side effects with any medication, but for the allergy medications, generally there's not any major side effects for these medications. That's why most of them are available over the counter. I would start 2 weeks before and go at least till the end of the season, if not a couple weeks later, to make sure that you cover that entire time.
Frank says, I take Claritin D every single day. Sometimes it makes my heart race, but if I don't take it, I feel terrible and my head gets congested. So do you suggest that I try something else, even though the Claritin works so well for those symptoms?
So I think you're on the right track. You started with the Claritin. I don't think you need the D on a regular basis, and I see a lot of patients that come in with this. It's heavily marketed to have these D medications. The D just means a decongestant, so you're basically just adding pseudoephedrine to this medication. And the side effect of that is heart racing, high heart rate, and high blood pressure. So I typically don't recommend patients take that on a regular basis. Certainly if you're having a lot of nasal congestion, it's kind of a short-term thing, not a problem, but to be on that on a regular basis, probably not the best idea. So what I would actually do is switch from Claritin, switch to that nasal spray.
Okay.
The nasal sprays are a lot better for those medications. They're a lot better for those symptoms and will help to control your allergy symptoms but not give you those side effects of a racing heart.
Okay.
If you do get some periodic congestion on top of that, then you can always pop a pseudoephedrine as well. Or maybe short-term use of some other nasal sprays like Afrin and eosinophrin. But I would be cautious about that as well. Those are the nasal sprays that everyone hears about, that those are difficult to get around and you get addicted to them.
Right.
Those are the medications we're talking about. The Flonase, the Nasacort, etc. Those are great allergy medications, but the Afrin and the eosinophrin really should be short-term use, 3 days or less. They'll give you the same benefit as the D, the decongestant, the pseudoephedrine, but without going through the whole body. So it's generally a little bit more tolerated as far as the heart racing symptoms.
Okay, so let's say I'm going to the grocery store, the drugstore, and I want to get the nasal spray. Is there something I should look for to avoid if I, like you're naming some brand names, but what is it in them so that I'm sure that I'm either getting the right thing or avoiding the right thing?
Sure, if there's any question at all, ask the pharmacist. They'll know what you're looking for. You want a nasal steroid spray, okay, as opposed to a decongestant spray. The decongestant sprays are the ones we don't want you on long term, 3 days or less. The nasal steroid sprays, the fluticasone, the triamcinolone, the mometasone, those are all the ones that we want you to be on. So if you look at the generic name, the ones that's in the parentheses, the ONE is probably a clue that it's the right one, but any question at all, ask the pharmacist.
Okay, that's great news. Jim says, every year I get 5 to 6 sinus infections. Is that the sign of something more serious?
If you're having that many sinus infections and they're lasting more than 2 weeks, okay, less than 2 weeks, probably viral, but longer than 2 weeks, you're getting that 5-6 times a year. I would definitely talk to an ENT, someone who works with sinuses a lot, to look to see if maybe you have a chronic sinus condition. You may need some heavier duty medication. You may need surgery. That is a discussion that would need to be tailored to your individual position. But certainly if you're having that many sinus infections, that's above the normal.
Yeah, that sounds pretty terrible. God bless Jim. So doctor, let's go. Now we're going to see a specialist. We've run our gamut of all of the medications that we feel like we can do, and it's time to see a specialist. What are some of our options there to help us through this season?
Sure. So at the specialist, you're probably going to get allergy testing of some sort. We can do that with the classic skin pricks, either on the forearm or on the back, especially for our younger patients. Once we've tested the patient, we understand what they're allergic to, we can then formulate what we call immunotherapy. Immunotherapy classically is allergy shots. Everyone's familiar with allergy shots or has at least heard of it. So that is an option. The downside of that is you got to come in every week for a shot.
Right.
People don't like needles. It's the time commitment. It's the fact that you need to come in off of work or off school and into the doctor's office to get those shots. So that is a downside, but it certainly helps if you're on those allergy shots for a long time. patients see a good response and you're less dependent on medication, you have less symptoms, and patients do really well. The other option for those patients that can and do not like shots, they don't have the time available to come in, busy professionals, kids that are in school, there's an option of sublingual treatment. So there's multiple options that are out there now that have come out in the market the last few years where they can actually take pills that are geared towards specific allergies, like grasses or ragweed, that you can use as just a tablet, a dissolving tablet underneath the tongue. Or if you have multiple allergies to multiple different allergens, different pollens, etc., we can actually give you the same formulation that you have in allergy shots. We can actually put that under the tongue.
Oh, wow.
So it's an easier way to do things. It can potentially be more expensive and not necessarily available in every location, but it is certainly an option for those patients that have those restrictions or those fears of shots.
Right. Well, doctor, thank you so much for spending time with us today.
Perfect.
And these were some really great questions that you answered. So if you'd like to learn more about allergies and sinus, the program here at Cooper, then make sure that you see our Ask the Doctor videos. Just log on to the website, cbsphilly.com/CooperDocs. Thanks again.
Thank you.
This video is sponsored by Cooper University Healthcare.